Seems to be a nightmare scenario that Quebecers have to ponder at times. Death in an emergency room in this province. That is the story of France Boisclair, 73-year-old woman that died of an aneurysm on August 11th. She waited 17 hours in the emergency room without seeing a doctor, died in a toilet off the side of the emergency room. When questioned about this incident, Quebec's Health Minister Christian Dubé responded, "This kind of error, this kind of mistake happens." A lot of questions about that response and the current healthcare crisis. Let's now go to André Fortin, who is the Liberal MNA for Pontiac and the official opposition critic on healthcare matters. He's on the line. Mr. Fortin, welcome back to the show.
Good morning, Mr. Macklin.
Okay, so first things first, maybe we could just briefly tackle Christian Dubé and the response here. He's asked about it. Personally, I don't think the guy was trying to be callous. I understand when you read the article, it can definitely sound callous as opposed to what happened in real life. But take us to that moment, the questioning on this death.
So much like you did in your introduction, we introduced the story of France Boisclair and the her final hours at the Joliette emergency room and the way in which she died and the way in which her sister found her in the bathroom and we tried to get some answers from Minister Dubé as to what's being done especially for the emergency rooms that are really struggling. And there's a few emergency rooms across the province where the ER doctors tell us that it's always a critical situation. It's always almost a dangerous situation for patients. So we tried to get answers, and usually Christian Dubé is somebody who will take the time to be very very sensitive, even apologetic to families. But on this one, he turned back to, okay, well, we're doing what we can, and these things happen, and it didn't come out the way it should have. And I think as elected representatives of people who frequent ERs, we just can't accept that it happens sometimes. It's our job to fix it.
So, to the comment that these kinds of mistakes happen, right? There clearly was an error of judgment, triage-wise, right? There's somebody didn't make the right decision to get this person into care or put them in the right priority sequence. To that notion that these mistakes happen, what level of those types of mistakes are acceptable in a healthcare system? You'll find it all over the world, by the way. What level of those types of mistakes are acceptable?
Well, here's the thing, and you're right, it does happen in various parts of the world, and but it seems to be happening more and more here in Quebec, and it seems to be happening over and over in certain emergency rooms, and we absolutely have to be cognizant of that. And if we have something to ask Minister Dubé today is look at those ERs that are critically problematic. I'll give you an example. The Châteauguay emergency room is any day you will look at the government scoreboard or wait times there. It's over 10 hours wait for patients, not patients who are on gurneys, patients who are just walking in the ER. That's way out of proportion with anywhere else in the province. And that ER is regularly at 180, 200, 230% occupancy rate. And we know that patients are put at risk when it's over 130, 150%. So when you have an ER like that, where 3 deaths have occurred of patients waiting to see a doctor, we expect serious attention, serious changes made to that specific ER. If we could do it everywhere across the province all the time, that'd be great. But there are places that patients are put way more at risk than others, and that's one where we're asking the health minister to put all of his efforts on.
So when we see issues and we see certain hospitals come up in the conversation more often than they should, statistically speaking, right? It's the Lakeshore Hospital in the West Island. You brought up Châteauguay or Joliette in the case of France Boisclair, right? If we see hospitals that are often getting attention for the wrong reasons over and over again, does that make a case to you, I don't know, for more centralized control where the local, or does it make the opposite case? Because it's interesting, because there are certain hospitals that don't have this same type of problem, right? So what in your mind, these stories and the disparity depending on what hospital you're in, Does it make a case for centralization, decentralization? Very curious to get your thoughts.
I'm not so sure it makes a case for either, to be honest. It makes a case for everybody, from the health minister down on to the triage nurse, for everybody to collectively say, okay, we have an issue with the Chateauguay ER, the Lakeshore ER, Joliette, or wherever else. And it's not a one-off. It's not just today it's at 180%. It's always at 180%. We've had patients die there. What can we do to fix it? Let's put all of our efforts. And maybe that means, okay, we'll have a little bit less of a focus somewhere else. But we have to find solutions for ERs that are losing patients because they're not being seen by anybody. The tragic thing in Madame Boisclair's death is that it took about 2 seconds after her death for her to see a doctor to try to resuscitate her. But we can't let situations like that happen over and over and over and say, okay, well, it's just another day at the office.
We're with André Fortin, Liberal MNA for Pontiac. He's also the official opposition critic on healthcare matters for the Liberal Party. So let's talk about Bill 15 for a second here, the reform of the healthcare system. And, I know it's early, but do we have any early indications on how Bill 15 is playing out?
Not really. I would love to say that something has improved since Bill 15 has been passed, but the truth of the matter is the Agence Santé Québec is really only put in place once you've got the Board of Administrators, once you've got a CEO, once you've got a delegation of power from the ministers to the agency, and the agency doesn't yet exist. The only thing we really know about it is the CEO is going to be paid a bucket load of money to take on that position. And that hasn't happened yet. I think about 50 people applied for the position. But until we really have people in place, the structure can't really change. So expect by the summer to start seeing changes. But at this point, it's almost like everybody in the healthcare world is standing still, waiting to see what this will mean, and sometimes not making the necessary changes and adjustments we need to make in the meantime.
Let's talk about this healthcare dashboard, the tableau de bord, that to keep track of the healthcare system. Do you use it, and how useful do you find this dashboard to monitor the situation across the province?
I absolutely use it. I think it is for government to have a level of transparency like this one. Now, we want to make sure the data is always correct, and we saw last week a pretty glaring mistake with the number of Montrealers who were waiting for a psychiatrist. I think was at 13, which you and I will know is not the true number. But in most circumstances, it works, and it gives us an indication of, okay, well, there really is it allows us to target the problem areas. So say, okay, we really have a big wait time for dermatologists in the eastern townships. What's happening? Why has that wait time exploded in recent months? And so it allows us to question the healthcare minister. Now, the problem with it is that typically we follow the numbers. I'm sure the minister follows the numbers, but we can't get responses as to why certain situations are getting worse than others. And so I hope internally they're using it to fix these problems. But from a public transparency standpoint, we know the issue, but we don't really know what government's doing to fix it.
Yeah. Any positives? Do you see any positives right now?
In terms of the healthcare network in general, I would say if there's any positive in the healthcare network is that it seems that some people have come back to the public sector from agencies. The minister had told us there was a number floating around that in Montreal there was about 250 people who were employed by agencies who are coming back to the public healthcare network. And as the date where the agencies or the healthcare system can no longer deal with agencies, and I think it's end of year 2024 in Montreal and Quebec City, hopefully we can bring back some of those people to our public sector. If anything seems to be working, it's that bill that we all worked on, all parties together earlier on this year. But that doesn't take away from the bigger problems of general attraction of healthcare workers, which is the number one issue across the system.
We do have to leave it there. Mr. Fortin, thank you so much for coming on the show.
All right. Have a great day.
André Fortin is Liberal MNA for Pontiac and the official opposition critic on healthcare matters.